Ready? After you became married, was there a point in 1995 where your husband had some kind of an accident or a mishap at work in which he fell from a truck bed down to the level of the ground? Yes. And how was it that you came to learn that that had happened to him? How was it that I came to learn? Did he come home and tell you about it? Did you hear about it some other way? You tell us. Generally, he got home a couple of hours before I did from work, and I think I had gone shopping or something. In the course of the evening, he said, by the way, I went to the doctor today, and I said, are you okay? And he said, yes. Defendant's counsel, objection. The court, objection overruled. And that was how you came to learn about it? Yes. You have to give a verbal response. Head nods are not allowed. Oh, I'm sorry, yes. Mrs. Crabtree, from that day up until May of 1996, did you ever know your husband to miss work because of any injury that he had suffered falling from that truck bed down to the level of the ground? No. Now, turning to May of 1996, did you come to learn sometime that month that your husband once again had had a mishap or an accident at work? Defendant's counsel, objection. The court overruled. Yes. How did you come to learn about that occurrence? Well, when he came home late at night, somewhere around 10:30 or 11 o'clock, and he said, you know, I'm hurt, and he told me briefly what happened, and he said he wanted to go to bed, and that's what he did. Did he witness any complaints of pain and discomfort to you that evening? Yes. Did he tell you where the pain was? His back. Did he tell you in words or substance how he had gotten hurt at work? Yes. What did he tell you about it? He was operating on the jackhammer, and he pulled it out of the asphalt and wrenched his back. Sometime after that, did your husband go to a doctor? Defendant's counsel, objection, irrelevant. The court, objection sustained. Was your husband eventually referred to a Dr. Grimes? Yes. Can you tell us, Mrs. Crabtree, about how many visits did your husband have with Dr. Grimes up until the time that there was a surgery? I would say 4. Did your husband also, during this pre-operative period, have an office visit or office visits with a Dr. Phil Lunt? Yes. How many visits were there with Dr. Lunt? 1. Now, focusing for the moment on the visits that occurred with Dr. Dale, did there come a time during the course of those visits where Dr. Dale broached the subject of surgery? Yes. And where in the course of these series of visits was it? Was it among the first visits, the last visits? You tell us, please. Defendant's counsel, objection. The court sustained. When he brought this subject up, can you tell us, please, what he told you about the surgery? Okay, I'm trying to get it chronologically correct. The court, take your time, ma'am. All right, this was after the physical therapy. Okay, we asked what could be done, and he indicated that he thought Steve was a candidate for surgery, that his part would be to remove the pressure on the nerves, and then he said, I want you to meet with Dr. Lunt, who's a colleague of mine, and I've worked with him before, and he wants us to talk to him about surgery, about fusion. Mrs. Crabtree, during the course, withdrawn. Just go to the jury. Just so the jury is clear on that, were you physically present at Dr. Dale's with your husband on that occasion that you told us about? Defendant's counsel, objection. Vague. The court sustained. Okay, in the course of this conversation with Dr. Dale, did he mention anything to you or your husband about risk inherent in the surgery that he was talking about? No. I'm going to ask you a couple of specific questions, and I know that your husband, you've been present every day of the trial, have you not? Yes. Let me ask you this. Did Dr. Dale specifically mention the possibility that the surgery could cause injury to the nerves in Steve's back? No. Did he mention that the surgery could cause your husband to become paralyzed? That the surgery that was going to be done? Yes. Defendant's counsel, objection, indefinite. The court sustained. Did he mention that the surgery might result in no improvement or even in a worsening of your husband's condition? No. Did he tell you that your husband's weight placed him at an increased risk during the surgery at that visit? Yes, ma'am. No. You mentioned at that visit, did the subject of weight come up at some other time in the course of the treatment with Dr. Dale? Yes, the first visit. Please tell us what conversation occurred on that subject at the first visit. We encouraged Steve to lose weight. Did he say why it was that he wanted your husband to lose weight? Defendant's counsel, irrelevant. The court overruled. Something to the effect that surgery always does better on thinner people. Returning to that, the last office visit with Dr. Dale and the risks. Did he mention to you, Mrs. Crabtree, anything about the risks related to whatever it was that Dr. Faust was going to do during the surgery? Defendant's counsel, objection, leading. The court, sustained. Now, you mentioned physical therapy. Is it true that your husband was prescribed a program of physical therapy by Dr. Dale during that period of time between the May and the months subsequent thereto in 1996? Yes. Are you observing things? And did that physical therapy help your husband improve his symptoms in any way? No. During that same period of time, was he prescribed certain medications by Dr. Dale? Yes. As you observed it, did those medications make him feel any better? Defense counsel, objection, bad in form. The court, no, overruled. Yes, after that visit with Dr. Dale that you were telling us about, was there then a visit with Dr. Fontanetta? Yes. Were you present during the office visit with your husband? Yes. During the course of that office visit, did Mrs. Crabtree, did Mr. Fontanetta say in words or substance that he proposed to do surgery on your husband? Yes. Doctor, is it your testimony to this jury? That was 240.
140?
240.
I don't think it was a little quick, not that quick.
Yeah, like the first minute was on the dot, and it's timed at, it's a certificate of merit, so it's 260. The rest of it, I fell behind a little, but it was 240. Okay, I'll give you another one. Doctor, is it your testimony to this jury that the pre-albumin test was useless as far as Mr. Gray was concerned? Yes, that's right. Now, that was ordered, was it not, at St. Francis Hospital? Yes, it was. And it was recommended by Dr. Rand, is that correct? Yes. And it was ordered by you, correct? Correct. Where was the test performed, by the way? At Long Beach Medical Center. Doctor, any other useless tests that you ordered for Mr. Gray, the plaintiff in this action? Plaintiff's counsel, object to the pejorative adjective, if Your Honor, please. The court, yes, don't characterize the test in that manner, counsel. Strike it out. You may answer the question without the word useless in it. There may be some tests which may have been ordered. We have no meaning for it. But you ordered them anyway? Yes, sir. As a matter of fact, you don't have a specific memory of Mr. Gray and your treatment, do you, right now? I certainly have a memory of Mr. Gray's treatment. You do? Certainly. A specific memory? I can't be specific. I can't go back, but I do remember treating him and what problems occurred, so my memory is good. Isn't it true you only have a vague memory? I didn't say vague. I would say somewhere between clear-cut and vague. Doctor, do you remember giving testimony under oath back in October 2005? Yes. So you recall being asked these questions and giving these answers, page 11, line 10, as follows. Question, Doctor, do you understand this deposition between concerns care rendered to Dr. Gray? Answer, yes. Question, do you have an independent recollection as you sit here today of the patient Gray? Answer, I can't tell you yes or no. I know the situation, but I can't tell you anything more than that. I have a vague memory of what the situation was, but I don't have anything specific. Do you recall being asked these questions and rendering these answers on October 5th, 2005? If they are written there, of course. Defendant's counsel, while plaintiff's counsel concedes that I have read from the transcript accurately, plaintiff's counsel, I will so concede without conceding the relevance or materiality. The court, that is satisfactory. Proceed to the next question, counsel, if you please. You told Dr. Neary that you remember specific conversations that you had with the nurses. Is that correct? On the basis of the record, yes. But when you were asked that, you said you only had a vague memory. Isn't that right, doctor? With respect to the question of a vague memory, let me say, the court, hold it, doctor. Defendant's counsel, the question calls for a yes or no answer, Your Honor. The plaintiff's counsel, he is answering it. I'm asking you a yes or no question. Has your memory gotten better as we were approaching trial? Actually, when you approach trial, your memory gets better as we approach trial because we are reliving the record. Certainly things we know because they are written out. Right? Right. We know, do we not? You did not order a white blood count for Mr. Gray? Wrong. Until the 19th of March, is that correct? That is correct. And you know, doctor, when Mr. Gray was in the hospital, the white blood count was tested nearly every day. Don't you know that, sir? I don't know. I have to peruse the record. I am going to show you the Plaintiff's Exhibit 2. We have flagged a page. Do you see that? Yes, I do. Plaintiff's counsel, if Your Honor pleases, how is the How is this relevant? The court, I presume we will see. Defendant's counsel, it has a bearing, I assure you. The court, I will take it subject to connection. Does that page refresh your recollection? No, it does not. You just read the progress note I showed you. Yes, I did. Doctor, is it your impression or your belief that the nurse called the attending doctor on March 13th about the swelling that she says she detected? Plaintiff's counsel, I strongly object to this question, Your Honor. The witness was not the attending doctor, and this would be rank hearsay, I submit. The court, isn't that so, counsel? Defendant's counsel, I will withdraw the question and reframe it. Doctor, I want you to assume that the attending doctor, whose name happens to be Johnson, will come here on Monday and testify under oath that that is not his note. Would you accept that? Okay. Doctor, let's back up a second. I think we went off track a little bit. Earlier on direct examination, you said that the problem which the plaintiff had as far as the swelling is concerned was detected on March 13th. No, I misspoke. He was actually notified on the 14th. So, as I understand it, he was not notified several days before he left the nursing home. The doctor was notified on the very day that the patient left the nursing home, correct? Yes. Now, let's just back up a second. I show you the nursing progress note. Unfortunately, the margin is cut off, but on the original chart that you have, that this is from March 13th, correct? Plaintiff's counsel, referring to the nurse's progress note. Is that right? Defendant's counsel, yes, the nurse's progress notes. Now, doctor, I want it to be referred to about 10 lines down on the 7 a.m. to 3 p.m. shift note over on the right-hand side where there is a portion of a reference that begins with TX. Do you see that? Yes. TX stands for treatment, right? Yes. And this was written for the 7 a.m. to 3 p.m. shift as follows. Treatment to stage 4 decubitus bone as per MD's orders. Do you see that notation? Yes, I do. Am I reading that correctly? Yes. Now, what does that mean? What is the treatment of stage 4? Plaintiff's counsel, I object. The nurse who wrote that should tell us what it means. The court, no, the witness is qualified to answer the question. I think the nurse must be referring to orders that were recommended by the medical nurse. So why does this fade out? No. How's that? Tough? Too slow?
No, it wasn't.
All right.